Good day, everyone. Today we'll be discussing the superficial heating modality of paraffin wax bath. It is the application of the molten paraffin wax over the body parts, and the temperature of the paraffin wax, it is maintained at 40 to 45 degrees Celsius, while its melting point is at 51 to 55 degrees Celsius. But if we pour this much molten wax at this temperature on the body part, it can cause the burn to the body tissue. So due to that, we have to add an impurity so that their melting point lowers down, such as we add liquid paraffin or mineral oil, right? And the ratio of the composition of the solid wax and liquid paraffin is usually 7:1 or 6:1. Sometimes petroleum gel is also added. So then the composition will be solid wax 7, liquid paraffin 3, and petroleum jelly is 1. So 7:3:1. Or sometimes simply the solid wax or liquid paraffin or mineral oil in the ratio of 7:1 or 6:1 is added. So the mode of transmission of heat from the paraffin to the patient's skin is by the means of the conduction. Now, all this paraffin wax, they are kept in a paraffin wax bath unit. It is usually a stainless steel container. It has mains, thermostat, a pilot lamp, a lid, and a caster. So initially heating is quicker with this type because there is no water jacket to be heated. And the container, it contains wax and paraffin oil. So when we switch on the heating element, it is usually located in the casing of the paraffin wax bath unit. The thermostat, it keeps the temperature fixed or static in the range which is adjusted with the knob. And the thermostat pilot lamp, it indicates whether the thermostat is on or off. So power pilot lamp function is to show whether the power is on or off. And the lid, it usually covers the container, and the caster allows the paraffin wax bath container to be moved from one place to the other. Now, next are the methods of application, which are important. So any part to be treated, it has to be cleaned with soap and water, because we don't want any moisture or any sweat over that part. So moisture is to be soaked with towel. It should be a dry part. The position of patient, it will be such that the part to be treated, it comes very close to the wax bath container. Now, before application, we have to ensure there is no moisture over the body tissues, and the wax is placed on the body tissue by various techniques. And usually the treatment time is 10 to 20 minutes. Now, the techniques of application, mainly there are 4 methods. First is a direct pouring method. Direct pouring method, that we use a mug or a utensil and we pour the molten wax on the part to be treated. And we usually give 4 to 6 layers, and those layers are made by pouring the wax. After pouring one layer, we wait for a few minutes so that the wax, it gets solidified, and then another layer is applied over the previous layer only, and then the wax is allowed to solidify for 10 to 12 minutes. And after this, that the part, after 4 to 6 layers, we cover the body part with a towel. So that is a direct pouring method. Second is a brushing method. In this, we can use the brushes of different sizes, and we apply the molten wax over the body tissue. So several coats like 4 to 6 or 6 to 8 are applied over the body tissues, and wax is allowed to solidify, and then again we wrap it over by a top. Third is a direct immersion or dipping method. Now in this, the body part to be treated is directly immersed into the container of the paraffin wax and taken out, right? Sometimes if we need to, or we are treating the distal parts, so what we do is we can just take the mug and we can pour the part into that mug. And once the wax it solidifies, then the part is again immersed to make another layer of the paraffin wax. And again, after making the layers, we have to wrap around by a towel. So first was the direct pouring method, brushing method, direct immersion or dipping method, and last one is a toweling or bandaging method. Now in this, the towel or a roll of bandage, it is immersed in the molten paraffin wax, it is dipped into the paraffin wax, and then that bandage is wrapped around the body part, and several layers can be made over the body part. And these methods, they are preferably used when we are treating the proximal part of the body, but this method is very least used. The best method is a direct pouring or brushing method. And once the treatment is given by the paraffin wax, it can be reused for the next session. But we need to regular clean or changing of the wax is necessary to ensure the good hygiene. So talking about the effects and uses, mainly the paraffin wax bath, it provides superficial heat to the tissues and it increases the local circulation to the area. It increases the pliability or flexibility of the skin, and it reduces stiffness and thus also reduces the pain. Mostly the indications in which we can use paraffin wax bath therapy, they are rheumatoid arthritis, osteoarthritis, joint stiffness or adhesions, post-immobilization stiffness, scars on the skin, etc. Mostly we use it paraffin wax bath for the distal joints. Now next are the contraindications. The contraindications where we are not supposed to use the paraffin wax bath therapy, like in cases of open wounds, we don't use it, skin rashes, any allergic conditions, any impaired skin sensation, or if a part have a defective arterial supply. These are the contraindications for paraffin wax bath therapy. Now there are how we maintain the paraffin wax bath unit. Usually we sterile it by heating it to the 212 degree Fahrenheit. For reuse, sterilization should be done frequently. And we sometimes drain the melted paraffin wax, filter it out and replace it back for reuse. We have to change the wax at least once in a 6 months. Now there is a pro forma of patient's assessment for before applying the paraffin wax bath to the patient. First of all, we will be receiving the patient, then we will be knowing about the condition of the patient, and we also rule out any contraindication if they are present. So first of all, we will be going for the test tube test so that we know about that the patient can differentiate between heat and cold, and he can report if there is excessive heat. Then temperature of the wax is checked. Then the patient has to be explained about the treatment procedure, what you expect from the patient. You have to explain each and everything, that if the temperature is high or if you feel like that the any adverse reaction is happening or any negative feeling has to be reported, then we have to position the patient in a comfortable position, and the part to be treated has to be in close proximity to the wax bath container. We have to check all the contraindications before applying the paraffin wax bath. Once you have checked the skin sensation and you rule out that there is no contraindications present, then we can apply the patient with paraffin wax bath. And after the treatment, we can choose the method of treatment according to the patient's condition. And after we have terminated the treatment, we have to again inspect the skin for any burns or any adverse reactions. Thank you.